and it's your age. If you were 14 or 15, maybe it wouldn't be so comprehensive, but I'm going to go more comprehensive to nourish the pre and postnatal chi. And I know that there's a little red line there, but I'm actually going more with the center of the... Yeah. Okay, so now I have my foundations, the bones of the treatment. I'll put my stomach points in just again to highlight where I'm going. And none of those needles are really going to affect the presence of the nodes or ahshi points. Okay, so the pain is moving down the leg, so I'm going to use what point to channel the chi through the
kidney.
Chi line. Yeah, it's on the kidney line, opposite contralateral. So I'm going with the kidney line being here. Don't worry if I don't measure, sometimes I just see. Okay, so I'm focusing in now. Do you know what? It's mad. Sometimes.
Now you feel it.
A little. And I'm just going to jump in there because it wasn't there and then it's there, and sometimes you just got to go with it. And actually, the one that I'm feeling is a little bit off where I expect it to be. And here we go, watch this. Now, also, when you're feeling resistance, there was huge resistance there initially. That might have been like needle shock. Her body is tensing around it. So sometimes you let it sit for a minute. And now with that needle in, it's a little bit more difficult, but I'm going to go with what I know and what you'll know. So we're dealing with the whole area of the hip. It's like here, it's at the back. So I'm going to go with like a triangular. Might even use a diamond. I might even go mad and use a Y. Who knows? Okay, so I'm going to fix these needles. And then I'm going to get into more focused, maybe on the lower back. And what type of pain is it?
Pain is, you feel it constantly, but it is...
Ache or stabbing?
8 or 7?
No, sorry, is the pain like ache, an ache, dull ache, or stabbing pain?
I think 8.
Okay. Any knee problems?
Knee problems? No? No. Maybe I'm
So,
not aware of.
Okay. I'm going to do a good kidney nourishing treatment. Now I'm just looking around here to see if I can find just, you know, sometimes you take your mind off for a sec, you can lose it. But I'm going to go with here. Now I'm just going to fix this. And I'm going to fix this. And I'm going to let that one sit for a minute. And then I'm going to get into fine tuning. As I said, I want to make it comprehensive because of the age and the duration of this problem, it's going to be related to the kidneys. And it's no harm. And I know I'm going a little bit deeper with these. I'm kind of being guided to a degree by the needles, but also I want to go deep to get the constitutional chi. Okay, let's just see, because I expect that this point is going to have an effect on the back.
You think it is, yes.
So, how's the back pain now?
It's less than, maybe it's now 7.
Okay. Has it changed the area or the size of the pain?
Yes, it seems like it's go a little bit up above
Okay.
the lumbar.
Okay. Again, I'm just going to add a couple of points since it's going up. How far up the lumbar would you say it's going? Sorry, I know this can be, and this is important as well. Sometimes if you're asking 20 questions, it gets tedious, it gets monotonous and irritating. So when you know what point is going to have an effect, then you choose to ask the question when you expect to get a different answer. How's that feeling now?
Mm-hmm. Better.
Okay. I'm going to leave those sit for a minute or two and see if that improvement improves more. I don't even know what she's thinking in her head, but I'm thinking maybe it's at 5 or something like that. But if I can get 2, give me 2. So we're going to work on the hip and then come back. Okay. Tell me, how's your hip pain at the back?
Yes, now I feel here.
You're feeling it more here now? What about, you had some pain at the front as well?
No, the front I don't feel anymore, I feel it here.
Okay, cool. So right, the front pain is gone, so that would suggest that that's more, probably that one, which is surprisingly superficial, but hey, if it's working, it's a good thing. So it's more lateral. Now, let's try actually, because you could say that's kind of midway. How's that? Has that made any difference to it?
Yes.
So before adding more needles and then confusing it and saying, okay, now which needle is having the effect, try the needles you've already got. So what's the pain at now? It's gone?
3.
Okay, that's 70%. Okay, and it's only located here now, is it?
Yes.
Deadly. Okay, well, do you know what? 3 is a magic number. And 4 is that again. Look. Did you see the?
Resistance.
What happened?
But I'm going to come back.
There's big resistance.
How's that feel now?
Better?
How much better?
2.
All right. Okay, well, we go with 2. And the back. How's the back?
It's 3.
So 70%, 80%. What I might do, will we go for 3 here? Where is the back pain now? Is it more up the lumbar or?
No, it's down.
It's down. Okay. So I'm going to just check around here because I'm. And has it moved more lateral?
Yeah.
So the abdomen will tell you stuff when you trust it. Strange. Strange but good. I'm not trying to put words in your mouth. but I am. Right, I'm going to go with, just here feels
Do you
like,
feel a nodule there now, is it?
just ever so slightly, yeah. Now again, there's a few needles there, so it's important to remember which one you started working with. A little bit of resistance. And as I say, resistance is fortuitous because it tells you what needle is working, where the ahshi point is. How's that feel now?
I think it's almost gone.
Say that louder for the camera?
What? I think it's almost gone, yes.
All right, cool. So,
Strange, yes.
how long did that take?
Oh, not can we stop?
Stop.